As open enrollment begins on November 1st, expiring healthcare tax credits could raise premiums for 22 million Americans and affect access to affordable coverage. Vice President at the Economic Security Project, Adam Rubin, joins us to explain what these changes mean for consumers and how they could affect health coverage and costs for millions of families nationwide. Adam, thank you very much for joining us today. What's changing this fall, and why could it mean higher healthcare costs for families?
Yeah, health insurance costs are going to double or even triple for tens of millions of people this fall, and most of them don't know it yet. People who buy their own health insurance usually get it through the Affordable Care Act marketplace or Obamacare. And the tax credits that help keep the cost of that coverage down are expiring thanks to the big tax bill that Congress passed this summer. So November is open enrollment when people sign up for their plans for the next year. When they find out what those premiums are, for most people, it's going to be terrible sticker shock. So people who are already struggling with housing, utilities, groceries are going to see their healthcare costs going up as well.
All right, so how will this affect individuals and families in the state of Florida?
In Florida, premiums are set to increase an average of 132%, and 1.5 million people are projected to lose their insurance thanks to the cuts to the Affordable Care Act and Medicaid. To take a typical family in the Jacksonville area, a 60-year-old couple, they're working, earning $40,000, $45,000 a year each on a fairly basic health care plan, their monthly premium will increase by $2,022. So what kind of middle-class family can afford that?
That's a steep increase. All right, so who's being impacted, and how could this impact people who don't get their insurance through ACA or Medicaid? You kind of talked about it a little bit, but let's expand upon that more.
Yeah, if you're listening, you're affected. If you get your insurance through the Affordable Care Act, about half of those folks are working for or own small businesses. They might be farmers or freelancers or work in construction or restaurants. But for when somebody doesn't have health insurance and they get sick, they end up in the emergency room. So wait times go up. Hospitals spread the costs around on the rest of us. The insurance companies jack up their premiums. They're going to keep making their profits. So no matter where you get your insurance, the ripple effects are going to hit you.
All right, Adam, so why is this happening now?
These price increases don't have to happen. The big bill that President Trump and congressional Republicans passed this summer ends these tax credits. That's what's behind the health care emergency. But I think there is some hope. The congressional Democrats are insisting on extending these premiums to bring costs down. Most Republicans in Congress are refusing. That's what's behind this shutdown. But a number of Republicans are starting to say they're concerned when they hear about the price increases on people in their district. And so I think the hope is that they can persuade their leadership to get together and sit down for a bipartisan deal to extend these tax credits that could help keep healthcare affordable for all of us, because healthcare should be a right in this country and not a luxury.
All right, Adam, so what can be done about this, and where can we go for some more information?
People can go to healthcare.gov to find out about the premiums near them and get more information. And if you're struggling to afford your health insurance, I think you should let your member of Congress know, because they need to understand what the impacts are in communities all across the state of Florida.
Fantastic. Adam, thank you so very much for your time this morning. This is a very, very critical situation. And if you want to catch this segment again or others like it, just head over to First Coast News Plus.